All right, Dr. Hanna. So we get asked questions on the YouTube channel a lot about is there such thing as good polypharma? So you've mentioned polypharma. You've talked about the idea of prescribing more than one medication to treat one specific set of symptoms. But I guess the question that I'm fielding on the channel here is, when is it okay to have more than one psychiatric medication on board? Is it when there's different symptoms? Is it when they're non-responsive to one set or series of, or class, I should say, of medications? Like, where do you make that determination that polypharma is okay?
Great question. Polypharmacy, which is multiple medications being used at the same time, is something that has always concerned me. Mm-hmm. Think about it this way. When I start one medicine for, let's say we're treating ADHD, and we start a medication for ADHD, I am taking a risk, or we are taking a risk of some sort of potential negative side effect. And so that's one medicine. Now let's say I'm going to add a second medicine. I'm increasing that risk. I'm increasing a risk of a drug-drug interaction. That one medicine is going to affect the level of the other medication, and both could really do it, and increase potential side effects on both ends. I'm going to add another medication, and I'm going to get lost in what I'm doing. So my bias generally is to try to avoid polypharmacy. Mm-hmm. Now, reality is there is such a thing as partial response. Again, there's a clear indication. We've determined that there's a legitimate reason to use this medication, yeah. Right? So we've established that. The person is clearly tolerating the medication. There's no negative side effects that are problematic in any way, but they have a partial response. And let's say we're treating depression. So a person is still really struggling, and they have a partial response. Typically what I do is say, okay, I don't necessarily want to add, I want to switch. Mm-hmm. However, that means temporarily being on two medications. So it's a polypharmacy, but in my mind, I want it to be very temporary. I don't like the idea of using more than one med for treating one diagnosis per se. However, periodically I run into a situation where someone has a partial benefit. Let's say they're 50-60% better. We introduce a second medication, right? And we get better and we're good. And even though I've lowered one and I've increased one, and now we're on two medications and we're like, wow, this is what we want.
Well, yeah.
And then there's a little bit of a dilemma. The dilemma is, do we stay on two medications, even though a person's tolerating it both well, and you're getting clear benefit, so you can make the case for that, or we say, let me still try to get off that first medicine. That's exactly what I do. I still say, you know what, I still want to try to get off the first medicine and really only use the new medication and eliminate that if I can. So that's generally, where this comes up. Now, there are medications on the market that people talk about adding them to augment partial responses. And you'll run into this with medications that are FDA approved for, partial benefit to antidepressants. So if you can add an Abilify or a Seroquel or something like that. My preference is not to do that. My strong preference is not to use more than one med unless I absolutely have to, where we've tried other modalities. Because one of the things that a lot of times people forget is when you're in the middle of managing medications psychiatrically is there are other things you can do to help depression. There are other things you can do to help anxiety. There are other things you can do to help ADHD. And that we don't want to put all our eggs in the medication basket. Mm-hmm. And I think a lot of polypharmacy happens, at least for most circumstances, for looking for medicine to do most of the work.
Right.
And I think a lot of times that's how we end up with polypharmacy. Mm-hmm. It's the desire to help people to feel better, right? We want to get our patients well, but I think there's a cost to it, right? There's an obvious financial cost, right? The more medications used, the higher the expense. But I also think there's another cost. There's another cost in terms of side effects. Because if you have two medications on board, and let's say you need to go on an antibiotic, for example. Well, you have two medications now you have to think about in terms of drug-drug interaction, right? There's a hidden cost to it that a lot of times is not anticipated. So I try to anticipate in saying the least amount of medications, the better. There are some circumstances where I know I've had patients who are struggling severely, who are severely psychiatrically suffering, where they are trying to do all sorts of other things and they're really, really struggling. And in that situation, a lot of times we can justify saying, boy, we really got to do something here. We're in deep trouble here. And we do have to get more aggressive. And yes, there's a cost to it, right? There's always those risks of those negative side effects. But I'm very leery of when you start adding medicine of losing track what you're doing and where you start not realizing, wait, okay, now I'm on 3 medications, so what's doing what? And then you lose track and then you have no idea.
Yeah. I think the important point is that percentage that you gave, 60% better, right? So you are on one medication and it gets you 60% of the way to where you want to be. And it's at that point, I think, that a lot of physicians will start to prescribe that secondary medication to augment the performance or the results that we're seeing or not seeing, trying to achieve results. And that's where we're saying there's inherent risk. And the idea of adding to that 60% makes sense to me. I want 100%.
Yeah,
you want 100%.
Sure. We want people to do life well and to be able to function optimally.
Certainly. And I think that, speaking as a therapist, that's where, hello, right here. We want to try to augment what medication is already doing, and focus on skills, focus on strategies, focus on mindset, focus on the way in which you see the world that a medication just can't give you.
Yeah.
And I have to make that abundantly clear, because we can put our hope in a secondary medication or, polypharma as this, quick fix or this, surefire way to get the results that we want. But there is that risk that you're saying is just unwise to not consider strongly the cost of. And I just want to propose the alternative solution, or hopeful solution, which is investing that time and effort into good therapy. So that's one of many ways to augment it. And as you kind of stay tuned, we'll talk about some other things. I know there's things like exercise, diet, sleep hygiene. All of these things actually help the brain do what it needs to do to recover, to stabilize, to get better. And we want to have a conversation about all of that so that we can avoid just that kind of narrow perspective of polypharma alone as the solution.
Yeah.
So stay tuned, and we'll get there. Thanks.